Hey everyone, Dr. Mike here, and today we're talking about something super important, your heart health. Did you know that over 800,000 people have heart attacks each year in the US? That's a staggering number, right? What's even more concerning is that some medications we take regularly, even seemingly harmless ones, might actually be increasing our risk without us even realizing it. Yes, you heard that right. From the painkillers we pop for headaches to the antidepressants prescribed for mental well-being, research has linked certain drugs to an increased risk of heart problems. It's a scary thought, but knowledge is power. That's why in this video we're diving deep into 8 common medications that could potentially be harming your heart. We'll break down the science behind these risks and, most importantly, discuss what you can do to stay safe. So, buckle up, grab a glass of water, and let's get started. Let's kick things off with a group of medications most of us have in our medicine cabinets, NSAIDs. These include your ibuprofen, Advil, Motrin, and naproxen, Aleve, the go-to solutions for pain, fever, and inflammation. We often reach for them without a second thought, right? But here's the catch. Studies show that NSAIDs, even when used for a short period, can actually increase your risk of a heart attack. I know, it's a bit unsettling. A 2017 study published in the prestigious British Medical Journal found that taking NSAIDs for just 1 week could increase the risk of a heart attack by a significant margin, anywhere from 20 to 50%, depending on the dose. So how do these seemingly harmless painkillers affect our hearts? Well, they mess with those crucial hormone-like substances that regulate blood flow. This interference can lead to fluid retention, a spike in blood pressure, and even narrowing of the arteries. Imagine your arteries like highways. Narrowing them causes traffic jams, putting more stress on your heart. This increased workload makes your heart more vulnerable to clots, heart attacks, and even strokes. Now, don't panic just yet. If you have heart disease or high blood pressure, it's crucial to be extra cautious with NSAIDs. Talk to your doctor about safer alternatives like acetaminophen, Tylenol. Explore non-drug options like physical therapy, and consider incorporating anti-inflammatory foods like turmeric and ginger into your diet. Remember, your heart health is a marathon, not a sprint. Moving on to another class of medications that play a vital role in many people's lives, antidepressants. Specifically, we're talking about SSRIs like fluoxetine, Prozac, and sertraline, Zoloft, and SNRIs like duloxetine, Cymbalta. These medications are lifesavers for those battling mood disorders, but some research suggests a potential link between these drugs and an increased risk of heart problems, especially in individuals with pre-existing heart conditions. A 2018 study published in JAMA Psychiatry revealed that these antidepressants might contribute to abnormal heart rhythms, blood clots, and even higher blood pressure. They can also interfere with your blood's ability to clot, potentially leading to bleeding complications like hemorrhagic strokes. It's like walking a tightrope. While these medications address one issue, they might inadvertently exacerbate another. The risk is even more pronounced in older adults and those already grappling with heart disease or high blood pressure. So, what's the takeaway? While antidepressants offer invaluable benefits for mental health, it's crucial to have an open conversation with your doctor if you have any concerns about your heart. Remember, there are alternative avenues for managing mood disorders, such as cognitive behavioral therapy, CBT, regular exercise, and lifestyle modifications. And never ever stop taking antidepressants abruptly. Always consult your doctor and taper off gradually under their supervision. Now, let's shed some light on calcium channel blockers, a group of medications commonly prescribed to manage high blood pressure and chest pain. These drugs, including amlodipine, Norvasc, and diltiazem, cardizem, work wonders by relaxing your blood vessels, easing the workload on your heart. Think of it like loosening a tight grip. It allows for better blood flow. However, some studies suggest that these medications, especially when taken in high doses or for an extended period, might increase the risk of heart attack or even heart failure. It's like walking a tightrope. Finding the right balance is key. A study published in the journal Circulation found that certain short-acting calcium channel blockers were associated with a 25% increase in heart attack risk. These medications can sometimes lead to fluid retention, which can worsen heart failure or cause a drop in blood pressure, leading to dizziness and fainting. If you have a history of heart disease, it's crucial to have an open and honest conversation with your doctor about potential alternative medications like ACE inhibitors or beta blockers. These might be a better fit for your individual needs. And always be vigilant about any side effects you experience, such as swelling, dizziness, or irregular heartbeat. Your health is a team effort. Let's talk about diabetes medications, specifically some older generation drugs like rosiglitazone. While effective in managing blood sugar levels, these medications have been linked to an increased risk of heart attacks and other heart-related complications. It's a classic example of how addressing one health concern might inadvertently impact another. A landmark 2007 study published in the New England Journal of Medicine sent shockwaves through the medical community when it revealed that rosiglitazone was associated with a staggering 43% increase in heart attack risk and a 64% increase in the risk of cardiovascular death. These numbers are hard to ignore. The culprit? These medications can cause fluid retention, putting extra strain on your heart by increasing blood pressure. It's like inflating a balloon beyond its capacity. Eventually, it's going to burst. If you're currently taking rosiglitazone or similar medications, don't panic. Instead, schedule a consultation with your doctor and discuss safer alternatives like metformin, SGLT2 inhibitors, or GLP-1 receptor agonists. These medications offer effective blood sugar control with a better safety profile for your heart. And remember, lifestyle modifications like a healthy diet and regular exercise can work wonders in managing blood sugar levels while keeping your heart happy. We've all been there, that stuffy nose feeling that makes you want to climb the walls. Over-the-counter decongestants like pseudoephedrine, often known as Sudafed, and phenylephrine often come to the rescue, providing much-needed relief by narrowing blood vessels in the nasal passages. But here's the catch. This narrowing effect isn't limited to your nose. It can also impact blood vessels throughout your body, including those supplying your heart. While this might seem like a minor inconvenience, it can have significant consequences, especially for individuals with pre-existing heart conditions. A study published in the American Journal of Medicine found that pseudoephedrine can significantly elevate blood pressure and increase the risk of heart attacks, particularly in those with hypertension, heart disease, or a history of stroke. But it doesn't stop there. These decongestants can also disrupt your heart's rhythm, leading to irregular heartbeats or palpitations. And if you're someone who enjoys their morning coffee, smokes, or takes other medications that affect blood pressure, the risks associated with decongestants amplify even further. So what's the solution? If you have high blood pressure or heart disease, it's best to steer clear of decongestants altogether. Instead, explore natural remedies like steam inhalation, saline sprays, or antihistamines if allergies are the culprit behind your stuffy nose. Your heart will thank you. Chemotherapy, the cornerstone of cancer treatment, plays a vital role in battling this formidable disease. However, like many powerful therapies, it comes with its own set of risks, including potential harm to the heart. Certain chemotherapy drugs, such as doxorubicin and fluorouracil, have been linked to an increased risk of heart problems. It's a delicate balancing act, eradicating cancer cells, while safeguarding the heart's well-being. A study published in JACC Cardio-Oncology revealed that doxorubicin, a potent chemotherapy agent, was associated with the development of heart failure in a significant proportion of patients, up to 26%. This alarming statistic highlights the potential cardiotoxic effects of certain chemotherapy regimens. So, how do these drugs affect the heart? Doxorubicin, for instance, can damage heart cells, triggering inflammation and scarring. This damage weakens the heart muscle, making it less efficient at pumping blood. Fluorouracil, on the other hand, has been linked to artery spasms, which can restrict blood flow and increase the risk of heart attacks. It's crucial for patients undergoing chemotherapy to be vigilant about any unusual symptoms, such as shortness of breath, chest pain, or irregular heartbeats. These could be warning signs of heart problems. Doctors often monitor heart function closely during chemotherapy, using tests like echocardiograms to assess the heart's health. Testosterone therapy and anabolic steroids often make headlines for their use in enhancing athletic performance and building muscle mass. While these substances might seem like shortcuts to a chiseled physique, They come with a hefty price tag, serious risks to your cardiovascular health. It's like revving your engine into the red line. Eventually it's going to cause damage. A 2017 study published in JAMA Internal Medicine found that men who initiated testosterone therapy had a 30% higher risk of heart attacks and strokes within the first 3 months of use. That's a significant increase in a relatively short period. So how do these substances wreak havoc on your heart? Testosterone and anabolic steroids thicken the blood, increasing the risk of clot formation. This thickening, coupled with their tendency to raise blood pressure, creates a perfect storm for heart attacks. But it doesn't stop there. These substances can also disrupt your cholesterol levels, lowering the good cholesterol, HDL, and raising the bad cholesterol, LDL. This imbalance contributes to plaque buildup in your arteries, increasing the risk of blockages. Anabolic steroids, often abused by bodybuilders, can also cause the walls of the heart to thicken, making it harder for the heart to pump blood effectively. Long-term use has even been linked to sudden cardiac death. It's a dangerous game with potentially fatal consequences. If you're considering testosterone therapy, it's crucial to have a thorough discussion with your doctor about the risks and benefits. Only proceed if it's medically necessary and get regular blood tests to monitor your heart health. And when it comes to anabolic steroids, steer clear. Focus on natural ways to boost testosterone levels, such as strength training, a healthy diet rich in healthy fats, and adequate sleep. We've all experienced the discomfort of heartburn, that burning sensation that creeps up your chest after a spicy meal. Proton pump inhibitors, PPIs such as omeprazole, Prilosec, and esomeprazole, Nexium, are often the go-to solution, effectively reducing stomach acid production. However, long-term use of these medications has been linked to an increased risk of heart problems. It's another example of how addressing one health concern might inadvertently impact another. A study conducted at Stanford University found that individuals who used PPIs had a 16% to 21% higher risk of heart attacks, even if they had no prior history of heart disease. These findings raised concerns about the long-term safety of these widely prescribed medications. So how do PPIs affect the heart? Researchers believe that these medications might lower levels of nitric oxide, a molecule that plays a crucial role in keeping blood vessels flexible and relaxed. Over time, this reduction in nitric oxide can lead to stiffer arteries, increased blood pressure, and a higher risk of blood clots. Moreover, PPIs have been linked to magnesium deficiencies. Magnesium is an essential mineral that helps regulate heart rhythm. When magnesium levels dip, it can increase the risk of irregular heartbeats. If you're experiencing frequent heartburn, it's essential to consult with your doctor to determine the underlying cause and discuss the most appropriate treatment options. Use PPIs only as directed and for the shortest duration possible. Explore safer alternatives such as H2 blockers, dietary modifications, or natural remedies like ginger and probiotics. If long-term treatment is necessary, work closely with your doctor to identify heart-healthy options. So there you have it. We've covered 8 common medications that could potentially impact your heart health. Remember, knowledge is power when it comes to your health. While these medications serve important purposes, understanding their potential risks, especially for your heart, is crucial. Your health is in your hands. Always be proactive, have open and honest conversations with your doctor, and explore safer alternatives whenever possible. Don't be afraid to ask questions. Advocate for your well-being and make informed decisions about your health. If you found this video helpful, give it a thumbs up and share it with your friends and family. Let's spread awareness about heart health together. And don't forget to subscribe to my channel for more evidence-based health tips and advice. Stay informed, stay healthy, and take care.